I like to share my silicone plug insertion and removal technique. Right lower lid insertion, always go across the nose as you can see on the right side. Be sure that your thumb is on the depressor so you're able to release the plug at the right moment. The left hand or other hand goes as close to the punctum as possible, everts the lid, and puts lateral tension. So as you can see, the punctum is now pointing away from the patient. Now you can, while stabilizing your right hand on the nose, insert the plug. You saw the little click. Ideally, you pull away to make sure that the plug is in the punctum, but the lid is above, and then you release. You usually check to make sure that the plug is flush with the punctum, and use only the insertion side to tap it down. Never use any dilator or the side to get the plug further in. Removal, grab the plug by the neck and pull it out. Never use the lid because it may be torn off. Right, upper lid insertion. Upper lids are more difficult. Here you can sometimes go across the nose, sometimes you have to change hands and go in lateral. Again, you're trying to put lateral tension on the lid and evert the punctum as much as possible. This will allow for much firmer pressure. Again, you will see this kind of snapping of the plug into place. And then, as before, make sure there you go. We use the flattening of the punctal plug with the inserter side. Removal, as before, make sure you use your forceps to go right underneath the lid and then pull as much as possible. The shape of the forceps will allow you to get in underneath the lid because they're pointed. Left lower lid, now use your left hand across the nose to stabilize your hand. The left lower lid is everted with your right hand with the thumb as close to the punctum as possible. You saw that little snap that puts in. Make sure you pull up. Only use that side to make the punctal plug flush with the punctum. Left lower lid removal, as before, you can go from either side. I tend to go from lateral, grab it by the neck, pull it out. And the left upper lid insertion is similar to the right upper lid, with fixating the lid maybe against the brow. And here I need to reposition my hands to get better purchase on the upper lid to ensure that I can apply enough pressure to get the plug in. Upper lids, as mentioned before, are much more difficult than lower lid. The more you do this, the better you'll get. Again, I tried to position my finger as close as possible to the punctum to stabilize the upper lid. Insert the plug, pull back, release, and use only this side to tap it into place.